Is yoga safe? There is a concern that yoga could cause injury because it involves physical activity. However, clinical studies have not identified any significant risk of injury compared to other forms of exercises, and in some cases even lesser. Yoga is low-impact exercise and there are no contraindications for people with bone or joint problems. Asanas prevent backache, osteoporosis, heart disease and so on. In fact, those following yoga tend to be less fatigued by their work schedule than others due to stress reduction expected from the practice. They also recover faster after an accident, etc. According to researchers in the U.S.A, Professor Manohar Luthra says asanas slow down the aging process. There are also documented cases of yoga being helpful in recovery from chronic pain syndromes such as fibromyalgia and arthritis, diabetes and even cancer, heart disease and more. People with a history of hypertension should not do inverted postures as it can increase blood pressure. However, if there is no pre-existing condition or Dr. S advice against it, then inverted postures can be practiced after proper warm-up exercises like sun salutation without vinyasas, movement between two poses. One has to remember that yoga is an individual endeavor, but for safety's sake one must choose a good teacher who must have been trained by an experienced guru. Is yoga safe during first trimester? Yoga is a great way to exercise in the first trimester. It's low impact and not too strenuous, but it also energizes you and improves your mood. And since your body changes so much during this time, yoga is often thought of as a good workout for women expecting their first child. But be careful to avoid certain poses that can put pressure on the pelvic girdle or abdomen. Most experts agree that these poses are safe. Standing poses, including Warrior I, Virabhadrasana, Warrior II, Virabhadrasana II, and mountain pose, Tadasana. Seated forward bends like Upavastha Konasana, seated wide-legged forward bend Varasana, and seated spinal twist, Ardha Matsyendrasana. Back bends like bridge pose, Setu Bandhasana, or locust pose, Salabhasana. Inversions, like headstand, Sirsasana, or shoulder stand, Salamba Sarvangasana. But be sure to keep your head supported with a block or bolster so you don't strain your neck muscles. Avoid poses that put direct pressure on your lower abdomen, like the boat pose, because it makes you arch your back. Is yoga safe during early pregnancy? The answer is a resounding yes. Not only can yoga keep you fit, it also improves your mood and eases any physical discomforts such as backaches, nausea, insomnia and fatigue that may accompany early pregnancy. It takes a lot of energy to carry the extra pounds, or kilos, associated with pregnancy. Yoga can help women prepare for labor by strengthening their postural muscles, especially those around the pelvis, as well as breathe away aches and pains. Yoga also contributes to good sleeping patterns. It helps relax mind and body so you sleep better. A study of more than 1,650 pregnant women published in Journal of Obstetrics and Amp. Gynecology research found that those who practiced yoga were significantly less likely to report anxiety and depression. The findings suggested that yoga may be a suitable intervention for women experiencing mild to moderate stress during pregnancy. Yoga helps prepare you for the changes your body will experience in early pregnancy: weight gain, backache, food cravings. 5 poses that are safe during early pregnancy. 1. Pregnancy modifications in cat pose, Marjariyasana. 2. Pregnancy modifications in splits. 3. Pregnancy modifications in half shoulder stand, Ardha Sarvangasana. 4. Pregnancy modifications in bow pose, Dhanurasana. 5. Pregnancy modifications in forward bend, Uttanasana. 1. Pregnancy modifications in cat pose, Marjariyasana. This pose is great as it allows blood flow into the pelvis area where it's needed most during this special time. It also strengthens both legs, particularly around the ankle joint as well as pelvic muscles, all of which will stand you in good stead during labor. 2. Pregnancy modifications in splits. Splits pose, Hanumanasana, is also good for opening up the pelvis, particularly the groin area. This can be a great stretch to improve circulation after being confined at home for quite some time. The hips and pelvic area are very flexible now, so this pose will feel really nice. But if you do experience any discomfort on your inner thighs during splits, try performing it with one leg straight out in front of you instead, see image below. Both sides should feel equally open. 3. Pregnancy modifications in half shoulder stand. Ardha Sarvangasana, half shoulder stand. A good shoulder and upper back stretch that helps to relieve any discomforts in your neck, shoulders or spine, as well as raise the hormone, oxytocin, which promotes feelings of love and happiness. Straighten both legs out behind you, then rest your hips on a bolster. Use the hands to lift the lower body upwards slowly into a standing position while maintaining a straight line with your arms. The head should be positioned between the arms. This pose is good for relieving cramped feeling in the abdominal area during pregnancy and helps improve blood flow around this area too. You can also add a twist by bringing one arm over each ear. Press down slightly on one side so it faces directly forward. Hold for 5 to 10 breaths, then lower to return to all fours before switching sides. Repeat both sides 3 to 4 times if comfortable. 4. Pregnancy modifications in bow pose. Dhanurasana. Bow pose is wonderful for stretching the back of the body, especially useful during pregnancy when there is additional pressure on your spinal column. It also stretches the abdominal area, which will assist with digestion and constipation. Start by lying flat on your stomach with forehead resting on mat. Arms extended out in front of you as shown. Inhale and lift your upper torso upwards towards the sky while keeping legs strong, drawing navel into spine. Exhale, release head slowly back onto mat and hold position for 5 to 10 breaths. Lower back down carefully in a starting position and repeat 2 more times. 5. Pregnancy modifications in forward bend. Uttanasana. Forward bends are especially useful to relieve lower back pain during pregnancy. Encourage blood flow to the growing uterus, reduce swelling of legs and ankles by releasing built-up fluid, all while stretching out the backs of the legs and spine. Stand up straight with feet together, hands on top of your head as shown above. Then fold forward from your hips, pushing a little through your knees, and allow stomach to hang over thighs as you go, keeping arms extended forward at all times. Hold for 5 to 10 breaths, then slowly come back up into standing position before repeating 2 to 3 times if comfortable. Is prenatal yoga safe? Most medical experts are in agreement that exercise is beneficial for both mother and baby. But doctors don't know a great deal about how to modify standard exercise recommendations for pregnant women, and they're still sorting out the safety of certain practices during pregnancy. If you're interested in trying prenatal yoga, your best bet is to talk with your doctor or midwife about it. Your practitioner can help you determine whether this type of exercise is a good idea for you and also can recommend specific poses or activities to avoid during pregnancy. He or she may even be willing to offer guidance on modifying poses post-delivery as well. You should also consider taking a class that's led by an instructor who has experience teaching pregnant women. Is yoga safe for osteoporosis? The answer is not a simple one, but takes into consideration many factors, including the type of yoga practiced, the age and health of the person doing it, and his or her bone mineral density, BMD. In general, however, there seems to be no reason why osteoporosis patients cannot enjoy the benefits that can be derived from certain types of yoga. Often called the silent thief, for its stealthy nature, osteoporosis has been on the rise among both men and women in developed countries since 1940. The World Health Organization estimates that 200 million people around the world have it and that 50% are women. Although results vary widely depending on what study you look at, about 1 million Americans break their hips every year and about 300,000 of them are older than age 50. The fall-related costs due to osteoporosis have been estimated at $17 billion per year in the U.S. alone. What is it? Osteoporosis results from a loss of bone tissue that leaves bones more brittle and susceptible to fracture. Since old bone is not being replaced by new bone, once this occurs you no longer build up your skeleton with each passing decade but begin to lose it instead. In addition, your bones become less dense as well as thinner, so they break more easily, often without warning or significant trauma. For example, while 30% of hip fractures occur when people fall from standing height or lower, there are also many that happen while stepping down from a bus or curb. What is the cause? There is no specific cause for osteoporosis, but research has implicated such factors as genetics. Certain ethnic groups have greater risk. Gender. Women lose bone more rapidly after menopause. physical inactivity and physiological changes due to early or delayed menarche, late pregnancy and childbearing, use of oral contraceptives and smoking. Is yoga safe to do every day? Yoga is safe to do every day. I found it very therapeutic and got a lot out of it, but there are some things you need to know before diving into a daily yoga routine. Many people think that if something is good for you then more is better, right? Not always so. Yoga is great for your body. It can help manage stress, improve flexibility, build strength and keep your muscles strong. The name, Hatha, means sun and moon, meaning strength. You might even find that an hour-long session might put you in a state of bliss if the instructor has the right touch. So why wouldn't we all want to do this every day? Because yoga poses stretch muscles. And with stretching comes injury, especially when you're straining your body to extreme levels, sometimes even if you don't feel it. Yoga instructors will tell you that while there is an element of risk involved in the poses they are taught, and this is perfectly true, but many times students push beyond their own limits. Many yoga practitioners get hurt every day because of this. Poses like the downward dog can put up to 450 pounds on your lower back. Others, such as the plow, puts enormous pressure on the discs in your neck. And then there's always child's pose, a lovely stretch for the groin muscles, only meant for people who have no restrictions with their hips or groin areas. Is yoga safe with herniated disc? From the medical viewpoint, yoga may be especially beneficial for a person with an asymptomatic herniated disc. The muscles and ligaments of low back support and protect vertebrae in place, while at the same time allow it move freely. Doing yoga can strengthen these muscles. Therefore, those who have just one or two discs slipped out should do exercises to strengthen back to prevent slipped disc from getting worse. That's how central lumbar stabilization exercises work. Yoga is a common kind of such exercises that use not only body weight but also breathing rhythm and concentration on muscle contractions during sequences movement, asanas. It is true that doing excessive yoga, especially in bad seated positions, can worsen disc herniation, particularly when discs are already bulged or herniated. Overdoing it may exacerbate symptoms of sciatica too, such as neuropathic pain. But in general, cases of sciatica caused by slipped disc require surgical treatment rather than just exercises.